are clinical trials safe? I get that question a lot.
Mhm. Yes, they are very safe. And, most of you, if we were doing this presentation a year ago, most of you probably were naive to understand what clinical trials are. With COVID around, every day it's in the news, right? So clinical trial, clinical trial, clinical trial. So I'm going to explain the process in a nutshell what a clinical trial is. Yes, they are very safe because they are regulated by the FDA, and they go through phase one. In phase one, they are testing safety in humans. So these are human volunteers where the drug is being tested. So only after phase one, after FDA approves phase one, they get released into phase two. And what is phase two? They are trying to determine the perfect dose for the drug. So they have 2 or 3 doses figured out. So 2 or 3 doses and a placebo. So actually, if I was to go into a trial, I wouldn't mind going into phase two or phase three, because phase two, my justification will be there's a higher chance I'll get the drug and not the placebo. Uh, but we do phase two and phase three trials. When you come to phase three, and again, phase two has to be approved by the FDA, the results, the side effect profile, and everything, and then phase three. So if you are watching the news, Moderna, Pfizer, AstraZeneca have almost finished up with the phase three trials, and they're presenting to the FDA, and we're going to hear about it in the next couple of weeks. Similarly, when we do phase three trials, whatever trial it is done in large number of patients. So if there is a side effect which was not noticed, or if the results were skewed because the number of patients were not in the thousands, then phase three is validation. Validation that this drug is effective and it is safe. And then FDA studies it, and only then it gets released out into the market. The advantage of some getting involved in the trials is, let's say if you are in one of our trials and a year later, fibroscan and biopsy, if it shows the disease has progressed, meaning it gotten worse. So what happened? Why did it happen? Number one, you might have been on a placebo, which is possible in trials. Number two, maybe you are on the drug and it still progressed. So you have an aggressive disease. So some of our trials offer what we call open label trial. Means you have progressed. So when you're progressed, then they'll do open label, which means you will get the drug till it's approved by the FDA. So that is the big thing, especially if you have somewhat of an advanced liver disease, late stage NASH, or even mid stage NASH. If you are in a trial and it is progressing, then guess what? You may get into an open label. Because I still think it's 3 to 5 years before we have a drug for NASH.